All right, guys. So this will be my 2 month update. It's been about a month and a half since my last video. Last video was 12 days post-op. Said I'm going to try and keep all of these videos relatively short, but I actually do have a lot of information to put into this one. So it'll be a couple parts. I know one of my comments previously said I needed better lighting. So I'm going to go into some better lighting to show you guys, to let you guys look at my head. But I wanted to kind of have some notes written down of things I wanted to address. In this video, I'll address here, and then, we can do the other part. Issues since the last video, 12 days post-op, the itching. I would say around from the three week mark to well into, 5 or 6 weeks, the itching, at least in the donor area, was, almost unbearable. Just horrible itching. I saw some of the other guys had advised taking Claritin to help with that. Didn't help me at all. I took a Claritin every day, and there was times when the itching was just unbearable. I did at 1 month post-op, I got a haircut. I'm gonna edit in some pictures from that too. Really, I just had my barber bring down the other hair to sort of match this little bit, almost to look like a bald Caesar, to match the top. I guess like a one guard. Of course, since it hasn't been 6 months, I couldn't have him cut any of the transplanted area, which would be, the two temples or anything up here. He did kind of cut some of this down with scissors where it was, just a little longer. But like I said, I'll put those pictures in. Other complication, I did get some bumps that came up in my donor area. I texted the clinic. He told me just to use some bacitracin, bacterial ointment on that. I used that for a few days, and that went away. I'll let you guys, be the judge. I'll show my donor area, when I get in some better lighting. Again, I know, and this has been a topic of much discussion in all of these transplant videos, is over harvesting, and everybody knows I got 7,000 grafts, which I think is the biggest number I've seen in any of these YouTube videos. In my opinion, and I'm open to whatever you guys think. In my opinion, my donor area doesn't look that bad. Of course, it's still thin. I'm 2 months post-op. It is thin, and my donor area was very thick to start with. But we'll see how it bounces back, if it bounces back. For me, worst case scenario, I'm gonna fade it up anyway. So, I'm not growing the back of my hair out long or trying to grow it out long. So another somewhat more complicated topic is, so the idea for anybody who is thinking about getting a hair transplant, the idea that this is a very long-term commitment. I said from when I started doing these videos that I would be transparent with you guys, and I would be lying if I didn't say that there were moments where I was like, well, what the hell did I do this for? Like, man, it seems like forever that I've been waiting on these hairs to grow. And I work in healthcare, so I wear a surgical cap at work, and it just feels like I've been wearing it forever. But that's how it goes. It's what I signed up for. Besides the fact that I have to go back and get a second procedure to do my crown. So just know going into it, this is a long-term commitment. Judging from the videos, other guys' videos I've seen on YouTube, 5-6 months before it starts looking, decent. I have continued with, I bought a couple more, the clinic, they'll give you one bottle of the shampoo and the foam, which you only use the foam up to, I think, maybe 2 weeks or something like that. I did buy an additional one, and I did buy one of their vitamins, the biotin vitamins. So I've been using that shampoo, washing my hair every other day. I'm about to run out of those, but I bought some other biotin supplements and biotin shampoo just from Amazon. I was going to buy the one from them, but the shipping was just crazy. It was like like almost $90 just in shipping for it to come from Turkey. So I decided to forego that. And actually, asking you guys who have done a transplant, who are doing your videos, what are some items you guys use for moisturizing? Because one of the biggest things for me I found with washing your hair every other day. Obviously, African American people, we don't wash our hair every other day, or that frequently, because it gets dry. So dryness has certainly been an issue. So just wondering what else some of you guys are using for moisturization. I'm going to try and also address some of the questions that have been put under previous videos in this one. There was I can't remember the guy's name, but there was somebody who asked me about getting sedation before the procedure, just so they didn't have to feel the lidocaine injections. So I'll say this. Yes, the lidocaine injections were very painful. If you look at these videos, you'll see that's a consistent theme that comes up. Everybody says the lidocaine injections were painful, and yes, they were painful. The guy who left the comment was saying, I guess they gave him an option for conscious sedation. So it's not a thing where you'd be totally out, intubated. Me personally, I like to keep risks to a minimum. They were professional and all that, but so for me, if I'm in a new environment, I'm in another country. The majority of people working on you are not going to speak English. So me personally, I just wouldn't want to throw as few variables into that as possible, because there's always a chance that something can go wrong. So I personally would just go ahead and just bear through the lidocaine injections. I personally wouldn't fool with the conscious sedation. I think that is all the topics I had written down, but this is actually, so one more thing, but it's a pretty serious topic. I was debating whether or not I even wanted to put this in my video, and this may make it run a little long, but I think it's important to mention to you guys. It's not specifically related to my hair transplant, but it is specifically related to travel. And since a lot of you guys will be coming from the US, flying to Istanbul, which is a long flight, I decided to put this in. So 2 days after getting back from my flight to Istanbul, I got some pain in my legs. So I do have varicose veins in one of my legs. So usually with flying, especially long flights, I'll take an aspirin, I'll wear compression hose, I try and, get up and walk, because long flights are a risk factor in DVTs, what may commonly be called blood clots or deep vein thrombosis. As I mentioned before, I do work in healthcare. I'm an emergency room nurse, so I'm familiar with this. So I felt the pain, but it didn't feel like what I thought a DVT would feel like, but I was still concerned. So I called around to various urgent care clinics because I did not want to go to emergency room. Called around to various urgent cares to see if any of them had an ultrasound, which is kind of the gold standard in ruling out any sort of DVT. No, none of them had ultrasound machines. So I got in contact with my primary care doctor. Sent her a message. This was a weekend. So I spoke to the nurse on the nurse line, explained to her everything that was going on, my position, and she kind of agreed with what I was saying. Said, yeah, probably no need to go to the emergency department. You can follow up with the doc on Monday and go from there about getting your ultrasound. So great. So Monday, made the appointment with my doctor, and she arranged to set up for a ultrasound for me. In the 2 days, I want to say from then that the ultrasound was going to be in 2 days. In those 2 days that I was waiting for the ultrasound appointment, I started having pain in my other leg. And this felt distinctly like what I would imagine a DVT to feel like. So had the ultrasound done. Ultrasound technician confirmed that I did, in the varicose vein that I mentioned before, I did have some superficial thrombus in that, which is not a dangerous thing. Doesn't carry any risk to it. And she said that no DVT in either leg. So wow, great news. Okay, but I was still having a little bit of pain in one of my legs. But I had the gold standard performed. She told me no DVT, so I felt confident that there was no DVT. Spoke to my doc. She said great, but that I should follow up with vascular, just in reference to the issue with the varicose vein. Okay, so a couple weeks, some time passes. I follow up with vascular. Go in, really thinking I'm just going to be evaluated by the doctor, but find out that they want to repeat the ultrasound, to which initially I was a little resistant, because if you guys know how, insurance works, this is a new year, so deductible is not paid up. So I was worried about cost. Went ahead and, explained all that to her and told her, hey, I just got a ultrasound done 2 or 3 weeks ago, yada, yada, but, they went ahead and did the ultrasound. So she's did the ultrasound on my right leg, confirmed everything, we already knew about, the varicose vein there, and then started to do my left leg, which initially, like I said, I was kind of resistant. I said, oh, well, I just had it done. They didn't find anything there. And she tells me, well, you can refuse it if you want, not a big deal, but doc really wants to see it. Think about it for a moment. I say, yeah, you know what, go ahead and do it. And about halfway through doing my ultrasound, she asked me, did they ultrasound at this leg? And I'm thinking to myself, we just spent like 5 to 10 minutes talking about how they ultrasounded both legs. Yes, they ultrasounded that leg. And she says, hold on, I'll be right back. So at this point, I get nervous. I'm like, well, hold on, you'll be back for what? Why are you leaving? So she leaves. She comes back with an older lady who looks at my leg, and she says to the woman, yep, that's what it looks like. And so I said, well, are you seeing a DVT or what's going on? So they're, as techs, they're actually not allowed to go over results or anything with you. So she said to me, we can't tell you that. So I go in the next room, and the nurse comes in, and lo and behold, I have a DVT in my left leg. So for you guys that maybe aren't familiar with the condition, so DVT, or deep vein thrombosis, is a blood clot that can form in the deep veins, usually in the lower extremities, in your legs. There are several risk factors, but long flights and immobility is one of the risk factors. So the biggest part is, the first initial feeling was I was upset because I just had a ultrasound done, maybe a month before, and the thought that I'm 2 months post my transplant now. I was walking around with a blood clot in my leg for 2 months that they had missed. Again, like for you guys who aren't familiar with the condition, this is a life-threatening condition. At any moment in those 2 months, that blood clot could have broken off and killed me right there, right then, just like that. So the reason I thought that this was important to share in these videos is because, so for you guys that are traveling, let me rewind a bit. So one of the biggest mistakes I made coming back, it was a 10.5-hour flight, very long flight. I had a Valium left over from a previous surgery. So I took the Valium for the flight, and for 8.5 hours, I was asleep, slumped in my chair. That is most definitely when that DVT formed. So again, back to my reasoning for including this. So for all you guys who are taking these long flights, take your aspirin. But I would say, some people say baby aspirin, 81 milligrams. I say go ahead and take the full 324 aspirin before your flight. Get you some compression hose to wear. Get up every hour and stretch your legs. Take a walk. flight attendants don't like it, whatever. You gotta, you want to make sure you don't develop this DVT. So yeah, every hour get up and stretch your legs. Drink some water while you're flying as well. So yeah, I mean, crisis averted. Thankfully, now I'll be on. Yeah, sorry about that. Phone died there. So as I was saying, yeah, crisis averted. I will be on blood thinners for 12 weeks to deal with that DVT. But I just thought it was important to put that in the video since a lot of you guys will be traveling out there. And, like I said, a DVT, that's a serious situation. If any of you guys are unfamiliar, you can Google DVT and risks and all that. But yeah, it was a serious situation. But so any questions, anything you guys have, of course, you can leave in the comments, and I'll update again in a month from today. All right, so for some better lighting, and you guys can see I'm looking a little rough. I'm about to go get my hair cut and beard trimmed up, but I just wanted to show you guys what it looks like now, and I'll do another video when I get back from the barbershop. So it's 2 months. You can see, not a whole lot going on up top. The hairline is still there, pretty much intact. I'll try and spin around to show donor area, which doesn't look too bad. Of course, as you guys know, I did not get the crown done. I have to go back to get the crown done. My barber, I'll just have him bring all of this down to like a 1 to try and even it out. All right, so I will make another video after I have my haircut.